Didn't mean to. Seriously, this was just in my
happenstance
in my cupboard. Seriously, I tell you, if I did, I'm not afraid. Good morning, everybody. This is Jimmy Panetta, Congressman for the Central Coast of California and former board member for the Veterans Transition Center. It's my pleasure today to have a discussion with the Deputy Executive Director, Jack Murphy, for the VTC, the Veterans Transition Center, especially now during this pandemic that we're going through. I think obviously, we know a lot about the health issues that we're experiencing with this pandemic. We know a lot about the economic issues, but there are certain segments of our society, of our community, that don't get a lot of attention, especially now. And so one of the things I'm trying to do with these Facebook discussions is highlight certain issues, certain populations that aren't getting the necessary press that I believe is important, because we have to be mindful that there are many, many different populations and segments that live in our community here on the Central Coast. And of course, one of the ones that we are very proud of are our veterans. But therefore, one of the ones we also have to realize and watch out for are our homeless veterans. And I believe we are fortunate enough to have one of the most amazing and profound organizations here on the Central Coast, in that of the Veterans Transition Center, the VTC, an organization that does so much, not just for our veterans, not just for our homeless veterans, but for the community outside of the VTC and our community here on the Central Coast, in dealing with veterans and dealing with homelessness and dealing with homeless veterans, of course. And so I'm real proud that I was a former member, a board member back a few years ago, and to see how much the VTC has come along in more ways than other. And I'm so glad that we have the Deputy Executive Director, Jack Murphy, to talk about that and to talk about the services that they're providing now and what we can do to help out the VTC as well. Now, I can tell you, just last week, I saw firsthand what good the VTC is doing, not just for homeless veterans, but for our community, and that I was able to be a part of their food giveaway that the VTC does there, I think, on a weekly basis. And to see that there were people, veterans, active duty military, community members who were lining up to receive food. Free food is what we're dealing with right now and seeing throughout this community, throughout the Central Coast, throughout our country. But that's what's necessary. And it's also necessary that we not only have organizations like the VTC, but that we have people like all of you who will support the VTC as well. So to get us more knowledgeable about the VTC, I'd like to turn it over to Deputy Executive Director Jack Murphy, who you see on the screen there, to talk about the VTC and what's going on there. Jack, if you can give us a brief update. Once again, thank you for joining us.
Thank you, Congressman. Well, I'd like to start off with just kind of a broad overview. The VTC, the Veterans Transition Center, is a local nonprofit. It's a 501c3. We were founded by Colonel Tom Griffin approximately 21 years ago. So we've been in the Central Coast area predominantly providing housing for homeless veterans and their families. That's what we're well known for. That's where we excel. We're very, very good at that. We started out as a 58-bed program for a couple of decades. And Mr. Congressman, you remember when you were on the board, it was a 58-bed program. Right. Nowadays, we are a 94-bed program. We actually have 5 different programs. Shelter. We have a 58-bed transitional housing program that's broken down into 3 different types of programs. And believe it or not, now we have permanent supportive housing on site. So we are able to provide the housing, the case management, the resources that somebody would need immediately coming off the street as a homeless individual and staying in our programs really permanently because of the housing systems and programs that we've designed. But as you mentioned, we want to do a lot more than just focus on the homeless veteran community, the family members. We want to open up our resources to the broader community. We've partnered with so many different organizations to connect veterans with something that they might need, whether it's healthcare, mental health services, resources such as food, clothing, furniture. We would be a lot more than just the service provider. We also recently found out that that our stand down, our 3-day homeless veteran stand down, is now scheduled for the first week in June of next year, 2021. It was scheduled for August of this year, but unfortunately, because of the coronavirus pandemic, we've had to reschedule that, along with another couple of our programs. But there's a lot that's available. This is an odd time, as everyone would recognize. There's a lot of anxiety and stress within our communities. There's that feeling of isolation that you get just from being told to shelter in place. As veterans, as service members, that's not something we're used to. We want to be part of a team. We want to be contributing. We want to be doing things that are positive in our communities. And there's still ways that individuals can do that, whether they're volunteering, whether they're connecting with other veterans, helping out their communities. There's so many ways that we as a veteran community can continue to live our values of selfless service, of duty, of commitment to the community. There's a lot that can be done, and I'd be happy to tell you more about that.
That's outstanding. Yeah, no, I appreciate that. Yeah, you guys have come a long way. It's been great to see the growth there at the BTC in more ways than one. And I really appreciate all of the work that you are doing as a former veteran yourself. Thank you for your former service. Thank you for your service now. It's wonderful to see. Talk to me about the services that the BTC provides, not just for homeless veterans, but for women and for families too. I think that makes the BTC very unique in the state of California, if not the country.
We are one of a few programs in California that, so regardless of gender demographic, that allows service animals to come veteran. And it doesn't necessarily need to be a registered service animal. We're talking just a pet, an emotional comfort animal. A lot of the homeless communities they're not going to seek out housing. They're not going to seek out a program if that means that they need to literally divorce themselves from their comfort animal or service animal. So we're one of the few programs that has that makes allowances for individuals with animals. We're also one of the very few programs within VA Palo Alto healthcare system's catchment area. We're one of 2 programs that provides for family members that we have family housing available. In this economy, it's difficult, especially when you're on the economic fringes. And for family members, it's even harder. So we have 4 families in our program at any one time. The VA is very thoughtful and considerate of providing services for the veteran, but there's a shortage of resources and support that goes towards providing for the spouse and the children. I think today we have 12 children in our program and a total of 4 spouses. And we're also, I'll say, testing the waters with having couples sharing homes. We have a 3-bedroom home right now with 2 couples in it. And they're getting along great. And again, that is something that is unique in this area. And through conversations with service providers at Menlo Park and Palo Alto Healthcare Division, they asked us to try this out. In fact, they encouraged us to do it. And it's a unique way, I wouldn't say innovative, but it's a unique way for us to house even more veterans and to provide for more veterans in this area. We also are more than happy to, we have 6 units set aside for women in our program as well. We don't categorically deny entry into the programs for any reason. We've had gay, lesbian, straight, transgender. We have a transgender vet in our program now. So we are very open-minded, very supportive, very welcoming of the veteran community, whether they're in our programs now or whether it's a active duty service member's spouse or family that needs something. As you saw at our last food distribution on Wednesday, we had young families coming by to pick up food. They're economically feeling the hardship, or if you're a stay-at-home spouse with a small child and your husband or your other family members deployed or at work, you don't maybe feel comfortable going to the grocery store because of the need to socially distance a little bit. So here's a way where we can provide food for anyone in the community, regardless of whether they're homeless or not. And that's what we want to be known for, is a service to the community.
Yeah, definitely, and you're definitely doing that. You're feeling that expansion, that you're going beyond the fence line, I should say, when it comes to the services that you're providing, and it's much appreciated. So obviously, so you have the housing for your veterans, for your families, for your children, all types. Now, right now, how many units do you have?
We have. It's kind of an odd question. We have 24 duplexes, but we use them in different ways. For our residential shelter, for example, we have individuals that can be doubled up in a room. So we have a total of 94 possible beds. Of those, some of them are set aside. Four duplexes are set aside for families. We've got 6 beds for women. We have transitional housing, a shelter, and different types of programs. Here in the near future, probably around the winter of this year, we're going to be breaking ground on what we call Light Fighter Village. We're very excited about that. We've got a fair amount of the funding from both the state and the county. We've partnered with a local developer who's a nonprofit out of San Rafael, and that's going to be building 71 permanent supportive units from scratch. So it's going to be brand new housing, very tastefully done. It'll be modern. It'll be on site within walking distance of Martinez Hall, where we have a lot of our support structure for veterans, and it's also within walking distance of the VA clinic and marina, and a lot of the other shopping mall, grocery stores, things like that. So once that is built, and it'll take about 1.5 years to build it, it's going to be an exciting time to be part of the Veterans Transition Center. The next chapter is the former VA clinic in Seaside, next to Cal State University in Monterey Bay. The VA has awarded that to the Veterans Transition Center to use as housing, and it actually allows for us to have a different type of a facility. It's not dedicated to solely housing veterans. It can be used for veteran-focused nonprofits. It could be used for job opportunities, business opportunities. So there's a commercial potential there, and we really envision that to be a center of excellence to serve the veteran community. And it's so fitting that it's on the former Fort Ord. It's so fitting that it's in the former VA clinic, and that would be the one-stop for any veteran-related issue within the Central Coast. Very exciting.
Now the VTC is on the former Fort Ord as well as Martinez Hall, and these housing structures that you're talking about, the current and the future ones, are also on the former Fort Ord as well, correct?
Yes.
And your relationship with the Gorley Clinic as well as the Palo Alto Clinic, how is that?
It's going great. They're very, VA Palo Alto healthcare system, Dr. Fitzgerald, everyone up there is so supportive of what we do. And we have a great relationship with the Gorley Clinic here in Marina, especially some of their social workers and mental health practitioners, and those that are working within the housing component at the HUD-VASH department of that clinic. But overall, the VA recognizes that, straight line distance between San Jose and Santa Barbara, we're the only provider. There's a small provider in Santa Cruz, which is a great partner of ours, also the Paget Center, but that's only a 12-bed program. We vastly can house more veterans than they can, and there's a need. I mean, we are at 100% occupancy today, and we still have a wait list. So we are essentially, within the Central Coast, one of the sole providers of housing healthcare to veterans, whether that's substance abuse counseling, mental health counseling, or just resources and referrals. We're really one of the few organizations in this area that can do that. But we have a great relationship with VA Palo Alto and the Gorley Clinic. They're very supportive of us. Whenever we ask for consideration for an opportunity for us to expand, they're one of the first ones to show us ways to get that done.
Good.
They've been a very good partner.
Great. Now, you've talked about the housing, and you mentioned some of the counseling services. Go into that a little bit more. What exactly does the VTC have, at least as briefly as you can provide during this limited conversation?
So we've unfortunately had to reduce the in-person exchanges with our veterans, but we used to offer individual counseling, and that was done by licensed clinical social workers. We also offered group therapy. We also offered a substance abuse counseling program, a relapse prevention, and that was all in Martinez Hall, open to veterans that are in our program.
Right.
And then because we wanted to kind of invite the community and support them, we would have the gambit of 12-step programs, whether it was Alcoholics Anonymous, Narcotics Anonymous, Food Eaters Anonymous. We had a financial literacy class, but we've had to kind of curtail that because of the county health officers' directives to limit the number of personnel entering our building, for example. So right now, we still offer individual therapy done by a licensed clinical social worker. We do a group therapy, which in order to provide the social distancing, it's actually done outdoors. It's a garden therapy program. It's done every single day from 12 to noon. A day like today, it'd be a beautiful time to be out there. It's from Martinez Hall and the Unity Garden at Everyone's Harvest, which is another nonprofit. They help put that on, and we've got, I think, a dozen gardening beds that are quite productive, no pun intended. And once this COVID passes us here, we're dying to get back to normal and provide that milieu of group and individual therapy that we've been known for. We want to get back into doing surf therapy. That's been a very sought after program that we offer. And then we work with other organizations such as the HUD-VASH Clinic over at the Monterey Clinic to do recreational therapy. We've partnered with one of the ocean canoeing programs for Sunday morning canoeing for veterans. So there's a lot of different things we can do. We're just kind of on pause right now. But we're taking care of the veterans that are in our program now, providing them the mental health that they need, providing them supportive services that they need. And we're looking forward to opening this back up to the rest of the community. I'll mention briefly, we also host the Santa Cruz Veterans Center. Their therapist comes to VTC, comes to Martinez Hall twice a month, and he's there the entire day. And it is to see veterans in Monterey County so that they don't have to drive all the way to Capitola to receive therapy. They're able to come down to this area and support veterans as well.
Good. That's great. Now, just before we go, just want to hit on a topic that obviously the veterans community is unfortunately very familiar with, and that's suicide. Mm-hmm. And I do believe that that's something we got to be watching out for going forward in this pandemic in the larger community. But amongst our veterans, in regards to the suicide rate that unfortunately has appeared to remain the same, about 20 a day is what they say. What services, and if you could provide any advice for people out there as to any signs that they're seeing when it comes to veterans and any issues when it comes to our mental health going forward during this pandemic and thereafter?
That's a great question. First and foremost, recognizing the signs, seeing the change in someone's affect, seeing them isolate even more than normal, seeing them fall into depression or start doing things that are here than normally. But the first thing we tell folks is to connect with the VA. There's no stigma. There's no shame. Contact the Veterans Crisis Line. Their number is 1-800-273-8255. It's staffed 24 hours a day, and it's a great program in that if they can't immediately help you, they will follow up with a social worker in this area the very next morning. And I've seen it work so many times. It's a great way to at least make a connection. For a veteran who is feeling heightened anxiety, feeling perhaps that they might want to harm themselves, ask for help. Ask for help. There's no shame. And then when someone offers that help to you, take it. Take it. Yeah. When I retired from the Army, I was sitting around with nothing to do. I'd taken off my uniform. I didn't know who I was and what I was supposed to be doing. And I lost my sense of identity, my sense of purpose, my feeling of being part of a team or a formation. So I fell into a funk. And what got me out of it was volunteering with local nonprofits that serve veterans. I started volunteering in the Veterans Treatment Court program. That immediately filled my bucket because I was able to feel like I was being a meaningful member of a team again of veterans. And then I started volunteering at the Veterans Treatment Center, or Transition Center, excuse me. And that was just another way for me to continue serving the veteran community. I would show up twice a week in Birkenstocks and flip-flops and shorts and just help out. And eventually they hired me and I'm still there. But there's so many meaningful ways, whether it's Meals on Wheels, Salvation Army, the Food Bank, the VTC, Veterans Treatment Court. There's so many organizations that are willing to embrace a veteran who wants to help. And for those that are, feeling like they need to connect, much like I was, just to get over that funk, these are great organizations that are more than happy to help.
Outstanding, outstanding. Well, I think you said a lot in that last answer, and I really appreciate that. And I think what really sums up this community is we have a long history with our military, not just in our past, but I do believe currently and in our future when it comes to our connection with our military. And obviously, we have military members, present and former military members here on the Monterey Peninsula and the Central Coast. A big community of them. And as you know, some do need the services that you are providing there at the BTC. And so if anybody, let me ask you something. And obviously, it seems like you guys are doing well. Obviously, you could do better. We all could do better, and we all could need, we all need more funding. If someone wants to give to the VTC or donate to the VTC, how do they do that?
Well, whether it's in-kind donations of services or goods such as furniture, clothing, or direct monetary support, they can contact me at vtcmonterey.org. That is our website. I have a link off an email. It's info@vtcmonterey.org, and our telephone number is 831-883-8387.
Right, exactly. I was just going to say, I have it right there on my mug that I saw, and didn't even mean to do this today, but I grabbed it out of my cupboard, and glad I did. So once again, that number is 831-883-8387. And then just for people who are out there who are watching, if you ever need any help from our office, which there are, we do handle a lot of veterans issues in my office as a congressional representative for the Central Coast. Please know you can call me at 831-424-2229. That's what we do. We basically make government work for people, especially our veterans when needed, and be that bridge to the federal government and fight through the bureaucracy, which we all know as veterans can be a real pain in the butt sometimes. But my office, my staff is there to help veterans, anybody else with any federal issues. Again, 831-424-2229. Jack, want to say thank you very much for what you've done, what you're doing with the BTC, and thank everybody there, all of your staff members who are outstanding in their commitment to giving back and to serving those who served us, which we truly, truly appreciate. And I know Tom Griffin has done one hell of a job there as a board member. And thank goodness that we have a good working relationship with him. Thank goodness that you have a good working relationship with him, because we all know Tom is a force to be reckoned with. But the BTC is a force to be reckoned with. Thank goodness here when it comes to fighting for our veterans, fighting for our homeless veterans, and our veterans community here on the Central Coast. So I want to say thank you for joining us today. Thank you for this time this morning. But more importantly, thank you for your time and your efforts and your service to our veterans and to our veterans community and to our community here on the Central Coast. So thank you. Thank you, everybody, for tuning in. Appreciate it, Jack. Thank you.
Our honor. Thank you. Thank you, Mr. Congressman.